Finally, my pleasure to introduce Jean-Pierre Paccaud, who is the head of new business development with the Drugs for Neglected Diseases initiative. So his work includes identifying opportunities, contract structure, negotiation, procurement, IP, and alliance management. He founded Athelis SA in 2002 as a startup company until its merger with Merlion in 2006. Before that, he was, like myself, a humble academic where he worked in the School of Medicine at the University of Geneva, focusing on diabetes, cell biology, and immunology. So we'll see now if you'd like to come up and you can decide what to do depending on whether it works. Thank you.
Thank you very much for the invitation of the forum to have DNDi presenting a few of its activities, and particularly shaping it in the title and the goal of the conference, which is partnerships. Trouble is that being the last, everything has been already said intelligently about partnerships, how you build them, what you have to take care of. So I'm a little bit embarrassed because maybe my only chance is that I didn't prepare a set of slides so that you won't see for the X time the same very important, and really I'm not here making any irony. I think that everything that's been said is something that, you know, to some extent I have experienced yet, or maybe not, and that I will experience somehow in the future of the organizations. But in any case, what I'd like maybe to do is, because the nice idea of the video came a little bit late, which is not going to happen, go to our website. It's on the homepage. You'll be informed about what we're doing. Nevertheless, if I want to say a couple of things, I still need to put the landscape of what we are doing. The Drugs for Neglected Diseases Initiative is a not-for-profit, patient needs-driven virtual organization. It's based in Geneva. It has been created in 2003 upon the needs of Doctor Without Borders, physician, being exposed in the field with the incapacity to identify suitable treatments to treat, for example, sleeping sickness, which, as you all know probably, or if you don't now you know it, is affecting essentially very poor people in very remote areas. Hence, no drugs have been developed for treating this disease in particular, but it's not the only one. And MSF decided that something had to be done in the research area, hence the creation of DNDi. So we're 10 years old. We are an organization that also was created with endemic countries as partners initially, as well as Pasteur Institute in France and WHO TDR as well. The hallmark of DNDi is that, as I said, it's entirely virtual. We don't have labs. We have headquarters in Geneva, regional offices, lots of people in the ground. We're R&D organizations. We develop drugs, so we test them into patients. We have a very large body of people that are dedicated to clinical trials in the field, and it's about 400 people to date that are working on our clinical projects. We've constituted a pipeline of drugs to address neglected diseases, which I forgot to mention as a small list, but it would be sleeping sickness, leishmaniasis, Chagas disease. They're all parasite-borne diseases transmitted by insects as a vector. We worked on malaria. We're now exiting slowly the field, but we developed 2 drugs on malaria. We are developing a pediatric formulations to treat infants that are affected by HIV. And we are now entering into the Hellman's field. You heard this morning probably the lady from MDS. We are trying to figure out if there are drugs that can actually not only affect the baby worms or the larvae, but the adult, and have something which could complement these mass drug administrations towards elimination. Last point, our funding comes from from government agencies and the other half from philanthropic organizations or Doctor Without Borders. But all these details can be found. What I think is important to go now for a few examples to illustrate what partners are for us. They are the essence of what we're doing. So somehow everyone working with DNDi could be considered as a partner. But I would start by saying that this is a debate internally at DNDi. Who are we considering partners? And there is a person this morning, a gentleman, talking about, maybe we shouldn't talk about partners, but about relationships that could develop into a true partnership. Because, you know, as an organization doing R&D with proxies such as academia, research institute, Ministry of Health in endemic countries, control programs, CROs, contract research organizations, or pharmaceutical companies, we are dealing with a various kinds of different potential partners. And if there's a few points that we've learned over the years by engaging with these partners and ensuring that they will deliver what we are expecting from them, is really, once again, to understand what's in for them. And it's probably something that has been said in many ways. And interestingly, I've never heard, which is probably a good thing, you know, the win-win old-fashioned way of saying how to have two different entities working nicely together. It's old-fashioned in the saying, but I think it's still critical to understand that when you start engaging a partner, being a pharmaceutical company or even a CRO, to really understand what are the premises that make this particular entity willing to work with us, for example, what's in there for the partnerships. And again, it has been said, we need to have common goals. There's one thing that we've also learned, sometimes in a hard way, is that even if you identify very nicely which are the common goals, and you're sure that it's, you know, you have done your intelligence work, it comes out that these goals may change over time. And if you're not really careful about scrutinizing the evolution of the relationship, then you may end up being in trouble, or you suddenly see that the partnership is not working well. And those are, I mean, one of the few things that I want to highlight in terms of our difficulty or our excitement in building these partnerships is to, first of all, on top of building the trust, the relationship, which takes you know, a lot of human interactions, and most of the time, talking about human interactions, these are illogical things, and being a scientist, it's interesting sometimes to see how few logic comes into play, but this is something you can use as a tool. The really important, I would say, focal point for DNDi is to, on top of starting building this relationship, is ensuring that it will keep going into the right direction by ensuring the partner is still aligned. And it is one of the most difficult tasks, actually, we've been confronted with. And in terms of, you know, good projects, bad projects, I won't talk about the ugly ones. I'll give a couple of examples, maybe without mentioning too many names. I won't upset any of our current partners. We had a very interesting partnerships. Well, we'll have to name it because it's one of our highlight projects in malaria. Sanofi took over a project we developed and became our industrial partner. The configuration of that particular partnership, which at the end of the day results up to now about 300 million treatments distributed in 34 countries in sub-Saharan Africa by Sanofi on a scheme which is almost at cost, is a great success. It started very early on, 2004, 2005, and the match was perfect because Sanofi had a real intention to be active in the area and the clear also vision that they would be staying within that project for a long term. And they did what they had to do. They really managed the product very nicely. And this is now one of the very useful tool for treating malaria in this area. So here, on the long term, the relationship was created on a solid base because the vision of the company was a long-term vision. We had another relationship, which not as a good one. It started by a very aligned common goal. And then we realized that our intelligence may not have been as good as we should have been doing it, because what we did was to miss the political component into the entity we were actually working with. Politics is bound to being elected or not really being re-elected. Sometimes you just end up with everyone within the laboratory you were working with that have been disappearing just because they were not re-elected, the president was not re-elected, and then he had to leave and people would leave. So you lose completely the track of the, and the reasons why you were engaging in these partnerships. And then you lose a project or have very hard time to make it work. So in terms of the real essentials, again, they've all been mentioned, but for us as DNDi, what we're really struggling with is not the structuring of the deals, because it's very important to have a nice governance, to know how to end conflicts, if they are conflict, and all that type of thoughts and things. But it's really to understand what are the long-term goals and envision that these long-term goals may change, and how to anticipate on this is probably one of the most challenging aspects of the work we're doing in my unit, is anticipating the changes so that we can see either to find another partner or identify what can be meant to ensure that our goals will be fulfilled. And mainly, the difference from some of our partners is that they may have medium-term goals which are not aligned with our very long-term goals. So if there is something that we've been cultivating with DNDi is really to understand the landscape of the potential partners we need to work with and understand if their sustainability as a partner. And I'm sure that many other organizations are confronted with the same type of hurdles. So I didn't name the bad and I won't name the ugly. We have a few ugly as well. But all things considered, so far we're managing something like more 120 collaborations with 10 of the biggest pharma across the world. So it's quite challenging and it's quite exciting. And I'm sure that if we will be very happy to share some of our experience, or on the bad side as well, outside of the room. And I thank you very much. And sorry for the movie, but next time maybe.
Okay, thank you very much, Jean-Pierre. Okay, so the sort of timetable as we have it is to sort of finish at about 5 past. Now, that would only give us 10 minutes. So what I'm going to propose is that we actually go on to a 1/4 past, but the next session starts in here at 25 past. Okay, so people need to come in and set up. So if you want to escape for a cup of tea or coffee, please feel free to do so. But not for another 10 minutes. And then those who want to stay on for a further 10 minutes, we'll try and do that. So you've heard these presentations, and I just want to emphasize that in terms of public-private partnerships, we're talking about the partnership element rather than, if you like, the specifics of the projects necessarily. And we want to sort of interrogate the challenges not just of working with the private sector, but also of working with the public sector. It goes both ways, and there's considerable challenges for both of them, and what we can learn and do about it in terms of partnership. So do we have some questions people want to ask? Yep, up in the back there, please. Thanks. Sorry.
Hi, my name is Ayo. I have 2 questions. One of them is based on something that Jen mentioned, and it's something I completely agree with. One of the big issues you have with healthcare delivery in Africa is not drug availability, but actually the way we're able to diagnose, and the kind of situation where you may not have enough doctors to be able to tell someone that, oh, you have epilepsy. So it's not just focused on the drug availability. But my question is, how can we form partnerships that, one, helps a lot of the local education facilities to be able to train more people, to be able to create the shortfall that we have in the manpower in healthcare delivery systems, and what if those kind of things do exist, how do they manage it politically in the areas? The other question I have is to do with when you are making a public-private partnership in a lot of countries in Africa, do you have to factor in a lot more weight to the political climate of the country? Because those kind of things are subject to change, and they can determine how sustainable your project is going to be, depending on if it's going to be an election year next year, and that person may not necessarily be back in power.
Okay, can we have two more questions? Yeah, one down here in the middle, please. And one more after that.
Thank you. I'm Fiona Hardy, and I'm freelance. I'm very interested in the motivation of profit-making organisations in doing in partnerships, and I'm just wondering how great the role is in things like them getting tax breaks, in them trying to negate a negative image that they may have got, like, say, for example, with the oil companies. So I'd be very interested in what the panel say about that. Thank you.
Okay, well, let's take those three questions to begin with, and I guess I'll leave it open to everyone, but let's start with Jans in terms of the first couple of questions. I think the most pertinent to yourself.
Yeah, thank you for that question, and I haven't mentioned in my presentation a very particular initiative, partnership initiative we have on health system strengthening. That is currently being deployed in Uganda, where we partner with a London-based, very small NGO. It's called PEPAL, and the idea is it grew from the International HIV/AIDS Alliance, whereby we sort of discovered. I'm also at the alliance and the board, that there is a lot of money available for a lot of activities, rolling out of programs, but there is no absorption capacity on the ground. There are no or few local players that have the capacity to really manage this sort of programs. And there was then this partnership, the request to have local activists, local healthcare providers being trained in managing the issues they confront. And initially, the easy way to do this was give them a bursary to an MBA, exchange programs. But quickly we found that it was much better to do on-the-ground learning and create a win-win situation. And we partnered with the private sector, and Janssen participated in this and is now doing this for 10 years in a row, whereby managers from our company go into the context of the rural health setting, in this case in Uganda, and discover what the situation is, work together with the local actors, identify very specific program needs, and then work for 6 months, 1 year on how to solve that management issue. So this just as sort of an answer or reaction on your question, I personally believe that it is very important to work on this health systems, and in this case we focus on the 5th pillar of the WHO series of health system strengthening, which is exactly the management skills. It's nice to have drugs, it's nice to have facilities, but if you have nobody, staff that can run the thing and put it all together in one program, you're not one step further. So we are definitely convinced that that is a critical thing. I hope I have addressed the question.
Yep. Someone else want to comment on this?
Yes, just to add to that, that issue of building the capacity at the community level for community health worker volunteers, as well as at the district level, the health staff themselves. building that capacity is very important because there are two things that you either have the staff and they don't have enough skills or competencies to do the work, or you have enough staff, or you don't have the staff at all. And that's a very complex issue to handle sometimes because NGOs should not go in and take over the responsibility of recruiting health staff and paying them. When you do that and the funding comes to an end, what happens? If the ministries of health have not budgeted to include the cost of that health staff in their annual budget, the staff will leave because the NGO is no longer paying them. So it's a very complex dynamic that needs to be negotiated very carefully during the planning of your program and as you implement the program. But certainly what we do from a World Vision perspective, we work with the communities to recruit community health workers and train them to fill in some of that gap that exists within the health services. But we do not take responsibility for paying them. We provide tools, materials, like toolkits. We provide bicycles for them, we provide bags for them, we provide other, like mobile phones, for example, during the course of the program. But long term, the Ministry of Health, starting at district level, needs to start budgeting for taking over the responsibility of supporting staff at the community level.
Anyone else want to? Tom? Yeah.
Working. The statistics are pretty bleak. I mean, globally, we need to train 4.3 million new health workers across the globe. There are 57 countries, we all know, in the world who have a huge deficit in terms of health worker training. I mean, one of the statistics I love is we have 130,000 medical students trained in Europe every year for a population of 1 billion, or just under 1 billion. And in Africa, there are 5,000 doctors trained for a similar population of 1 billion. So what a lot of people don't get in an Irish or European or US context is, you know, this is and I think the Ebola crisis has really pointed it out, is this is a whole continent which doesn't have doctors or nurses or ancillary healthcare professionals. And the work that's been done by Magnus and many others in the community health worker training space and that, you know, building that capacity is only part of the solution. And to answer your question directly, we need to build new online medical schools that really address the needs at a cost that's effective and safe and trains doctors and nurses in the field in Africa. There are 26 sub-Saharan African countries that have no medical school or one medical school. So, you know, the bricks and mortar approach isn't going to work. We now have a massive improvement in the ability to build online training programs, be they mobile or fully online training programs. And I think the next 10 years, you know, we've seen it with the early iterations with the MOOCs, we've seen it in corporate training. Higher ed is moving more slowly, but we're going to see, I think, one of the biggest changes over the next 10 years is the development of a really new model of healthcare professional training online. And that will be able to be done at a cost that governments can afford, because that's the real issue here, is who's going to pay. And it has to be the World Bank, it has to be governments, and they can only do that in a new model.
Thanks, Tom. If we can move to the sort of second question there then, which was, I think, really around the idea of, while we accept that it's everyone wants to do a good thing, within the corporate context, to what extent is that encouraged through things like tax breaks, and to what extent might it also be an attempt to sort of damage, limit in terms of historical characteristics? Maybe Carmel and then Linda, you could offer something.
Yeah, really interesting question. And I suppose when I think of the Accenture perspective, we give 1% of our global pre-tax profits to our community partnerships. And I suppose when I think about it, you know, why do we have a corporate citizenship function at all? Why do we have somebody like me in a full-time role leading this for our business? And for me, it comes back to the business case for corporate citizenship. Why do we do this at all? And in Accenture, we always say that there's 3 main reasons. So we do it for our people, we do it for our clients, and we do it for our reputation. So in terms of our people, we see corporate citizenship as a huge, valuable tool in terms of retaining our staff and also attracting new people into Accenture. So when they see the types of opportunities that they can get involved in terms of volunteering, in terms of building their skills, in terms of helping the community organisation, getting involved in some of our overseas programme and using their core skills on a pro bono basis to do something good in the non-profit sector. These are hugely attractive options to both our existing people and to new potential recruits into Accenture. If you think about it from a client perspective, you know, corporate citizenship is a great tool for us to engage with clients in new and different ways. So obviously we're engaging with our clients in terms of our core business and what we're doing for them on a day-to-day basis. But all the opportunities that corporate citizenship brings in terms of new partnerships, new ways of doing things, new collaborations, as Linda had mentioned in her presentation, that's hugely beneficial for us. And then in terms of reputation, of course, I mean, this is something we've talked, I think most people have mentioned how beneficial it is for organisations to partner with the non-profit sector, to follow our corporate citizenship or CSR themes, and to do something good, something that has to be good for business. But it does help our reputation if we're seen to be doing good in the long term. So yes, it is good for business. It's why we do it. I mean, tax breaks don't come into it. We have a certain budget that we set aside for it. But it's for all those reasons that I mentioned, our people, our clients, and our reputation. It's why we do it.
Linda?
Yeah, just to say, continue on from there, even if we asked earlier on what people's view of CSR is, and I mean, in the slide that I put up there with all of those companies, each of those companies would have a different view as well, and with that different view comes different motivations for getting involved in different projects. But I would say across the board, like Carmen has said, it's not about tax breaks as such, that doesn't really come into it. People can have different motivations around reputation, but if there isn't a solid programme behind what they're doing and you know they can stand over it and see how it aligns back to strategy, if it's simply a one-off piece that they hope will cover up poor practices elsewhere, it just won't work. I would say, I mean, I'm in great company on the panel with Accenture and Janssen as a J&J company of having hugely comprehensive programs in place, and you can see it when you go into the organisations how well they approach every aspect of what we would consider corporate responsibility, the responsibility to their people and to their customers and to the wider society. I was reminded when you asked the question, Marks and Spencer have what they call a Plan A, which is a series of 100 commitments to making their business a more sustainable and a more responsible business. And Stuart Rose, when he was their chair, said, every time we actually try and do something good, we end up making money out of it. And he said, that's a good position to be in. But it does come back to the fact that they have such a solid foundation. They don't just go into one-off or ad hoc partnerships for the sake of, on a whim, or trying to cover a piece of particular reputational piece. Everything is considered, and it pays dividends then in the end. So.
Thank you. And Jean-Pierre, just from your experience then, when you're partnering with large corporate companies, you know, do you sense it is for, they're interested to develop new markets, it's gilt money, what is it, why are they doing it?
Joker? No. I think it's a mixed bag of good and less good reasons. What has been really, I think, preeminent in the last 8 years is the interest in developing in being present in emerging markets. And for me, but again, it's my personal opinion, this has been one of the most stringent driver in the pharma industry to approach PDPs, organizations like us, and be more open to discuss what type of project we can develop, because they don't know the field. However, they understand that in 10, 15 years, some regions, Africa in particular, given already the growth rate that we're seeing in the continent, is going to be just unavoidable as their new markets. The conditions are changing in Europe and US. This is the main driver. Guilt factor, yes, always, and there is no reason why we shouldn't exploit it. And hopefully sometimes, and more frequently, individuals at various levels in corporations are always wonderful people because they are very excited about these projects. And sometimes you get even, at the top level, and this is key for us also, but unfortunately it's not sustainable. We can just mention the few recent, sacking of some CEOs. Some of those CEOs are really getting to understand that they have to do something more than just what the shareholders are asking them to do, which is, profit. It's a mixed bag, but I think it's quite interesting to take advantage of these different factors to leverage.
Okay, and Jans, if I can come back to you, because you sort of presented the prospect of trying to develop a product, microbicides, in a context where, let's say, the commercial value of them might not have been seen to be the greatest from a corporate perspective, but the social value was there. But how did you manage to bring that forth within your own company?
I think it boils back very much, and Jean-Pierre has alluded to it, to the motivation of certain leaders within a company. At the time when we were working on this vaginal microbicide, we were a small biotech. It was not Janssen, not Johnson & Johnson, it was Tibotec. And the founders of that company had a different business model. They had a sort of a model, okay, let's develop product for the first world, make our money with it, but at the same time, we want to be present for the medical needs of the developing world. So throughout their activities, there was always that question, how can we consider issues that are relevant for the developing world and make sure that they are also addressed in our clinical trials, in our development programs. At that time, when we had this opportunity to start a vaginal microbicide, indeed the investors, the private equities that had invested in Tibotec were not at all interested. That was sidelining the priorities. Thanks to the leadership of some the directors of the time, we were able to do that under the radar screen and piggyback on other existing programs because of the motivation of the employees, of the staff, of the researchers. All the teams were so committed to the HIV research and finding a solution, not committed to how many billions the product will eventually bring to the company, but rather how much can we contribute to a solution for HIV. And that made it possible that we worked on this sort of non-commercial program. And then to come to the history, J&J came on board, Johnson & Johnson, a multinational, big pharma. We at the time at Tibotec, we were indeed very much afraid once it comes in this bigger big pharma entity, such a product will immediately end on the shelf. And that's how we then started setting up a partnership with IPM, International Partnership for Microbicide, a not-for-profit development, a bit like DNDi. In that deal, we ensured that it was not necessarily about money. We didn't give them any money. We give them a compound, assured them that it would be royalty-free, but much more important and completely innovative in terms of agreement was that we would be there with them, along with them, to help the development, but only if they asked us. So we would not interfere in any other program. For each and every problem they encounter, they could ask us, and we would then identify the right expertise to help them. And that has been very, very fruitful for now more than 10 years that we are in that partnership. I think without having anything on paper, we are committing about 3 FTE annually to that program. And we have not given almost a penny. We have not given any money, because partnership is not about money. Partnership is about working together. and motivation to work to advance a program. And in this case, the big pharma, it's not about, it's about expertise that is available in such a company. But I go too far, I think.
No, this is lovely. And, you know, already I think it's clear that partnership is pretty complicated and there's lots of different perspectives involved in it. And in a sense, what I hope would come from this session would be that people would go away thinking it's more complicated than I had thought. And if we can at least take that first step and acknowledge that, and I would also like to say from the university perspective that there's good, bad and ugly in terms of collaborating with universities, and there's great problems there both north and south and with corporate and with private and so on. But I'd like to, because we've run out of time, which is a real shame, we want to try and catch up the program with the rest of the day. But if you just join me in thanking all the speakers and thank you for your questions.